Good afternoon, and welcome to this collective conversation organized by the Collective for Political Determinants of Health. My name is Katerini Storeng, and together with Sakiko Fukudapar, I co-chair the collective, which is dedicated really to advancing research on how power constellations, institutions, interests, and ideological positions affect health within different political systems and cultures and at different levels of governance. So this conversation series aims to bring an original and critical lens to global health debates by discussing how the political determinants shape different health outcomes. And it's a series that is organized with speakers from amongst our members. And today the event is titled Examining the Power of the Alcohol and Tobacco Industries in the Philippines and features Gianna Gayle Amul. And today's discussion is going to be chaired by another member of the collective, Kelley, who is a Tier 1 Canada Research Chair in Global Health Governance and professor in the Faculty of Health Sciences at Simon Fraser University in Canada. And her research focuses on collective action to address transnational health risks in a globalizing world. And this includes leading the Pandemics and Borders Project, an international team which has been analyzing the use of travel-related measures during the COVID-19 pandemics. And she has literally hundreds of publications on various issues to do with global health governance and policy. So we're very pleased that Kelley has agreed to chair today's event. I will now hand over to her and hope you have a good webinar.
Thank you, Katerini. Good morning, good afternoon, good evening to everyone joining us today. As Katerini said, my name is Kelley Lee, and I'm joining you today from the traditional, ancestral, and unceded territories of the Coast Salish peoples, today known as Burnaby, British Columbia, in the still sovereign country of Canada. I have the privilege of chairing today's session, and if you're interested in keeping up with the events of the collective, you can go onto the event page, or you can sign up for the newsletters, and Emma's kindly put those posts in the Zoom chat. So just some logistics before we start. The first half of the event, the introduction and the presentation, is being recorded for future publication online. The Q&A session, however, will not be recorded. So as audience members, feel free to ask questions, make comments, either by using the Q&A function or by using the raise hand function at the bottom of your screen to ask your question directly. And I'll keep an eye on those buttons. So let me begin by introducing our speaker today. She is Dr. Gianna Gayle Amul. She's currently an advisor on alcohol, drugs, and development at FORUT, Norway. She holds a PhD in global health from the University of Geneva's Institute of Global Health, Faculty of Medicine. She has worked as senior policy researcher and director of communications at Research for Impact Singapore and research associate at the Lee Kuan Yew School of Public Policy. She was part of the team that developed the ASEAN Secretariat's 2015 report on the ASEAN Socio-Cultural Community Scorecard. And Gayle was also a senior analyst on health and climate security at Center for Non-Traditional Security Studies in Singapore. The title of Gayle's presentation for us today is Examining the Power of the Alcohol and Tobacco Industries in the Philippines. So I welcome Gayle. I understand that your talk will be about 20 to 25 minutes so that we can have plenty of time for discussion with the audience. So I'll hand the audio and visual over to you now. Thank you.
Thank you so much for that very nice introduction. Let me just share my screen. Hope everyone can see the slides. Anyone say yes?
Yes, that looks perfect. Thanks, Gayle.
Okay, let me start then. So, good afternoon, everyone. Good morning to some and good evening to some. Thank you for letting me share my PhD research in a collective conversation. So today I'll talk about the power of the alcohol and tobacco industries in the Philippines. First, I will present a brief introduction about the topic. Then I will briefly present the methods that I use for my data collection and data analysis. I will then share a brief background on the alcohol and tobacco policy frameworks in the Philippines so you can have a better context of what I'm talking about. And this will be followed by the key findings on the power of the alcohol and tobacco industries. And then I will also share the lessons and challenges for alcohol and tobacco control in the Philippines. And then I will end with some conclusions and future directions for my research. So aside from being my home country, there are several reasons why the Philippines is a good case study to explore the power of the alcohol and tobacco industry. The Philippines is still a lower middle income country with 110 million people and a predominantly young population. So for both industries, that means a very huge market of opportunities. Second, alcohol and tobacco use are among the top 5 behavioral risk factors that contribute to the burden of disease in the Philippines. And third, the Philippines has implemented several alcohol and tobacco control policies in the past decade. And moreover, the Philippines is also a member of the Association of Southeast Asian Nations, which recently launched the ASEAN Framework for Action on Alcohol Control. Fifth, the Philippines is a party to the WHO Framework Convention on Tobacco Control and has implemented various measures that adhere to the FCTC. Additionally, the Philippines has strong transnational and tobacco and alcohol industries. Last but not the least, my own alcohol and tobacco control advocacy has given me access to the Tobacco Control Network and the alcohol policy advocates in the Philippines. So what did I set out to do? I wanted to examine the power of the tobacco and alcohol industries in shaping tobacco and alcohol policies in the Philippines. I also wanted to identify the challenges and lessons for alcohol and tobacco control in the country. So how did I do this? I use qualitative research methods to collect and analyze the data. So to analyze the power of the alcohol and tobacco industries, I review the literature on the alcohol and tobacco industry's activities in the Philippines. And to be more comprehensive and to triangulate the data, I also explored official government documents, corporate documents, including your annual reports, and news articles. Finally, I also conducted 13 interviews in the Philippines, all of them over Zoom because this was during the pandemic from 2020 to 2022. So I used the reflexive approach to thematic analysis by Braun and Clark. So I prepared an interview guide that can be adapted to the interview's general affiliation, whether they come from government or civil society or other organizations. I asked my interviewees about their experiences, perceptions, and insights on alcohol and tobacco policies, as well as also on the alcohol and tobacco industries. So of course, there are limitations in my study. I need to put this out there immediately. So one limitation is the convenient sampling of interviewees through purposive and snowball sampling. So it reduced the opportunities to interview representatives from the industry and from non-health government agencies, like those involved in trade and development. I address this by triangulating my data with publicly available data, including media coverage of industry statements about policies included in the study and press releases from the industry and non-health government agencies. And this is all because I wanted to reduce also my interaction as a researcher to the industry. And before I go to my findings, let me give you a brief overview of the policy frameworks for alcohol and tobacco control in the Philippines. So in the Philippines, alcohol control is mainly in the purview of the Department of Health, with an emphasis on alcohol taxation and drunk driving regulations. However, the Philippines does not have a comprehensive alcohol control policy. And on the other hand, tobacco control in the Philippines shows a more coordinated whole of government public health approach to tobacco control. And the Philippines has focused on tobacco taxation as a key policy strategy. I should also highlight here that the revenue from alcohol and tobacco taxes are earmarked for universal health coverage in the Philippines. So now let me walk you through my framework. First, the key concept here is power. We all know the definition of power. And another key concept is the commercial determinants of health, which refers to the conditions, actions, and omissions by commercial actors that affect health. Another key concept that you can see here is the legal determinants of health, and this refers to the legal instruments and institutions that shape all social determinants of health. And of course, the most important concept in this context is the political determinants of health. And these refer to the transnational norms, policies, and practices arising from political interaction across all sectors that affect health outcomes. And the three types of power, defined by Stephen Lukes, offer an analytical tool to identify the tactics used by the alcohol and tobacco industry. And the three types of power have been used extensively to study the role of corporations in global governance. So I will define each type of power in the following sections. So first, you can see here some photos that are from my own collection, showing some advertisements of the alcohol and tobacco industries in the Philippines. On the left is supposedly a drive safely public service announcement, and also a declaration of a celebrity that she is Filipino with alcohol products by her side, which is also very weird in a way that you can see both drive safely and also alcohol in one billboard. And this can be seen in highways in the Philippines, in one of the biggest highways in the Philippines, EDSA. There's also in the middle, this is a screenshot from Facebook of an advertisement of San Miguel Light, which is one of the most popular light beers in the country. And then there's also on the right a store in the airport, which has the brand of Marlboro and its signage, which is supposedly banned because advertising is banned, tobacco advertising is banned in the Philippines, but because of the retail allowances, they found loopholes that they can do this in the Philippines. So that's just a prelude to what I'm talking about. So let's cover instrumental power first. Instrumental power refers to the coercive power that corporate actors use to achieve trade and investment liberalization and expand global markets. So how did the alcohol and tobacco industries exercise their instrumental or coercive power? First, they lobbied profusely. We know this. In the Philippines, the alcohol and tobacco companies lobbied behind closed doors and were invited to public hearings for the sin tax reforms, or the tobacco and alcohol tax reforms, in Congress and the Senate. The alcohol and tobacco industries have also used litigation to contest or obstruct legislation and regulation. The tobacco industry, particularly, has a history of litigation against the Department of Health, and we also know of their history in filing cases against local governments that implement local ordinances to comply with the Framework Convention on Tobacco Control. So one is another example is the alcohol industry. For example, in 2012, the Distilled Spirits Association of the Philippines filed a temporary restraining order to stop the alcohol tax increase at that time, arguing that the law implies double taxation on both raw materials and compounded liquors, which would lead to a substantial loss for the industry. Fortunately, the local court denied the association its petition and argued that the courts have no authority to restrain tax collection and that the association does not have the right to be protected from the right of the state to collect taxes. There are also revolving doors, which refer, we kind of are familiar with this, I think, to corporate state connections created when business and political elites kind of exchange or switch between ministries or regulatory agencies to companies and vice versa. And in the Philippines, unfortunately, it is common for former government officials to be recruited on boards of tobacco companies. A former Undersecretary of Finance, for example, sits on the board of the Lusitan Group. A former Chief Justice, a former Governor of the Central Bank of the Philippines, and a former Finance Minister sits in the Tan Yan Kee Foundation, which is the CSR, or Corporate Social Responsibility arm of the Lusitan Group. The Lusitan Group, I should expound on this, is both alcohol and tobacco. It's part of both the alcohol and tobacco industry because it owns or partly owns the Philip Morris Fortune Tobacco Company in the Philippines, and also the Tanduay brewery or distillery. So, which is also one of the biggest alcohol companies in the Philippines. Then, of course, there's marketing. So while marketing tobacco has been comprehensively restricted in the Philippines, the tobacco industry often finds policy loopholes to circumvent regulations, as I've shown you earlier. On the other hand, alcohol marketing is very common and self-regulated by the industry, with the alcohol industry launching aggressive marketing campaigns every year. So you can see here the marketing expenses of the four largest alcohol companies in the Philippines from 2017 to 2021. I know I should update this with the recent data, but you can see here that there's only a small change in how much alcohol companies invest in marketing, even during the pandemic, which still amounted to at least 12 billion pesos every year from 2020 to 2021. So let's move on to structural power. Structural power refers to the agenda-setting power used by corporate actors to maintain an underlying control of processes and resources. So they exercise structural power by market dominance, also referred to as market power. And it's usually when a corporation, which is a substantial oligopolist or near monopolist, becomes significant in its ability to offer access to the relevant markets. And for an example, transnational tobacco companies like Philip Morris have dominated the cigarette market in the Philippines for decades. Transnational alcohol companies are also aggressively expanding their operations in the Philippines. For example, Kirin owns 49% of the San Miguel Brewery, which is the producer of San Miguel beer and several other beer brands. And San Miguel beer is a beer that was produced way before or during the Spanish colonial period in the Philippines. San Miguel Brewery was also the foundation for San Miguel Corporation, which is now one of the most dominant conglomerates in the Philippines, not just in the alcohol industry, but because of its diversification. San Miguel is everywhere from food, especially ultra-processed food, to oil and gas, to infrastructure, including highways and airports. Next is public-private partnerships. And this happens, we know, when businesses draw on the cooperation between business and government actors or civil society to pursue policy objectives in the name of participatory governance and achieving policy objectives with the use of private sector resources. And unfortunately, it is common for the tobacco industry to engage in joint monitoring programs as part of their CSR as well with government agencies. Government agencies would often rely on illicit trade intelligence shared by the tobacco industry because they don't have resources. Similarly, it is common for the alcohol industry to engage in partnerships for environmental and tourism projects, often as part of their corporate social responsibility activities. And of course, there is regulatory capture, which refers to a form of co-option of public agencies, policymakers, or regulations to serve the interests of commercial actors that they oversee and regulate. And this is a problem in the Philippines, especially because the tobacco industry is represented in an interministerial body in charge of formulating and implementing tobacco control measures. Self-regulation, we kind of know this, refers to the situation where business actors design, adopt, implement, and enforce their own rules that increase their active, autonomous rule-setting power through their codes of conduct and private voluntary standards. And in the Philippines, the alcohol industry has successfully lobbied for voluntary marketing codes for decades. And during the pandemic, to avoid e-commerce regulation, the Alcoholic Beverages Alliance of the Philippines voluntarily pledged to prevent minors from accessing alcohol products online. They also pledged to promote responsible drinking in virtual drinking sessions, or what we call in the Philippines inuman, through a social media campaign. And e-commerce platforms selling alcohol also joined this pledge. Finally, there is discursive power. Discursive power refers to the co-opting or hegemonic power in pursuit of legitimacy achieved through non-market strategies we've already mentioned, including corporate social responsibility programs and promotion of self-regulation that creates a system of values and norms. Now, the industry has used framing as a strategy to influence policy that strategically uses arguments to position themselves as vital actors in the policy process and where they define the policy problem and legitimize their policy positions. And by law, unfortunately, in the Philippines, the tobacco industry is included in the Interagency Committee on Tobacco, which I've mentioned earlier, which is in charge of the Philippines tobacco control laws. And by framing themselves as legitimate policy actors or stakeholders, the alcohol industry have succeeded in promoting self-regulatory frameworks for alcohol marketing in the Philippines. And this is further reinforced by corporate social responsibility. Now, in terms of CSR, the alcohol industry follows the same playbook as the tobacco industry. The tobacco and alcohol industries in the Philippines have invoked the Sustainable Development Goals in their CSR initiatives and are very good in strategically marketing their CSR. And because of CSR, there is increased interaction between the industry, government agencies, and civil society organization, which adds to this industry's discursive power. And government agencies and civil society organizations are often convinced to collaborate and even promote the alcohol industry's CSR. And during the pandemic, legislators in Congress felt so indebted to the private sector, including the alcohol and tobacco companies, because of their CSR. And because of this debt of goodwill, or what we say in the Philippines, utang na loob, Congress renewed a push for a bill to promote, incentivize, and reward companies for their CSR initiatives. And the CSR bill was railroaded in Congress and is now pending at the committee level in the Senate. Public-private partnerships in this context is a discursive tactic which the alcohol industry uses to frame themselves as responsible actors. And how do they do this? They strategically collaborate with tourism authorities to promote homegrown alcohol brands with global tourism marketing campaigns. And everyone here knows about Oktoberfest, right? The Department of Tourism in 2017, for example, has officially recognized and promoted Oktoberfest as an official festival in the country. And during the pandemic, alcohol companies supported the vaccination campaigns of the Department of Health. And that was a huge boost to their discursive power. So you can see here some examples. So CSR by a conglomerate, which is the Lushatan Group, which owns both an alcohol and tobacco company. They held disaster relief operations when the Taal volcano erupted in 2020. This was way before COVID happened. They were already there. And they, of course, used all their brandings on the packages that they shared with the disaster victims. And there's another example of government promotion of Philippine alcohol brands in their Philippine embassies. And this was even featured in the Department of Foreign Affairs website, where the Philippine embassy in Russia featured Philippine liquor at the tasting reception that they hosted. So now let's move to the lessons and challenges for alcohol and tobacco control in the Philippines, according to determinants of health. So note that these lessons and challenges are mostly based on my interviews in the Philippines. Considering that the political determinants of health. So while there is a global strategy to reduce the harmful use of alcohol and the recent Global Alcohol Action Plan, there is a challenge to further promote alcohol as part of the global health agenda. And this has not changed since I finished my thesis in 2023. So there's also the challenge to promote mental health as part of the alcohol policy agenda. I often see that mental health is not yet integrated in the alcohol policy agenda, which is a bit shameful, but it's also a very good opportunity. And this is a reminder that alcohol control should be included in a more comprehensive public health agenda. Anyway, so third, the challenge of managing conflict of interest when the tobacco industry is by law required to be part of an interagency committee on tobacco, which is in charge of enforcing tobacco control laws in the Philippines. There's been proposals to reform or amend the law in the Philippines to remove the tobacco industry representation in that committee, but it has not moved forward in either Congress or Senate. And considering the legal determinants of health, there is a challenge to promote regional alcohol governance that covers health and non-health policies. And this is important for a region that is now the target of the alcohol industry to expand operations in. And this is quite evident in the Philippines, where Heineken, a transnational alcohol corporation, has entered into a joint venture with the Philippine conglomerate and has established its own marketing arm. Second, there is the challenge of promoting global alcohol law and governance. So for low and middle income countries in the region, an internationally legally binding instrument for alcohol will help drive movements for effective national alcohol policies. And third, the problem or the challenge of using the law to protect alcohol policies from industry interference is challenging. It is invariably more challenging when the alcohol industry has entrenched itself as a seemingly legitimate and responsible policy actor on alcohol policies, even though it remains a profit-oriented entity, and the same applies for the tobacco industry. In terms of the commercial determinants of health, there is the challenge of using counter-marketing for both alcohol and tobacco. And this challenge is more critical for alcohol because there's still a need to increase the awareness of the public and legislators on the evidence of alcohol harms to society. And in the Philippines, there's very strong resistance to this, even within the Department of Health. Second, there is a critical challenge to protect the youth and children from alcohol marketing. And third, and probably the most important, is for the medical and public health community, along with intergovernmental health organizations and civil society organizations, to reach a consensus on alcohol harms. Tackling the myths of responsible drinking and healthy drinking has divided communities from making an impact on the evidence of alcohol harms. So here's an extract from an interview with a representative of a civil society organization in the Philippines. But it refers to the specific challenge of using the law to protect policies from industry interference. And in the Philippines, this challenge applies to the national and local levels, where the tobacco industry has used extensive litigation to delay and oppose tobacco policies. Here's another extract from an interview, this time with an official of an intergovernmental organization in the Philippines. And the official specifically referred to the challenge of strictly regulating alcohol at the national level when there is no global move to do so. So now let's move to the conclusions. I'll go through this quickly. In terms of the political determinants of health, it is evident that the lag in alcohol control and stagnation of tobacco control in the Philippines have had a multiplier effect on the different types of power and tactics that the alcohol and tobacco industries have used in the country. Such power has enabled the alcohol and tobacco industries to avoid, delay, and weaken regulations in the Philippines, more so for the alcohol industry. In terms of legal determinants of health, there's also evidence from my research that the governments in the Philippines have been weak in regulating the influence of the alcohol industry. My work points to the need for governments in the region, especially the Philippines, no matter their level of economic development, to comprehensively regulate the alcohol and tobacco industries to achieve the SDGs to reduce the burden of NCDs. And in terms of the commercial determinants of health, I think we need to emphasize the inconvenient truth about the alcohol industry. Because it is less regulated, the alcohol industry has an advantage over the tobacco industry in shaping and influencing policies, especially in countries like the Philippines. And without a legally binding instrument and local statutory policies, progress in alcohol control will remain dismal. So, quick implications. In terms of policy implications, it is important to emphasize that industry interference, unfortunately, is inevitable. However, policymakers need to be aware that creating the favorable legal and political environments for the alcohol and tobacco industries can only amplify public health harms. And this relates to the need for anyone working on alcohol and tobacco policy, whether in government agencies, legislators' offices, and civil society organizations, to increase their legal proficiency and political adeptness so that they would know how to avoid industry interference. So I think I'll just move to that. But I think I would like to emphasize that we, as also an advocate, my research has important implications for advocacy because it provides a baseline for civil society organizations in Southeast Asia to continue monitoring and publicly reporting industry activities in the region. And my work also calls for more awareness among civil society organizations, journalists, researchers, and media outlets of the pitfalls of corporate social responsibility of the alcohol and tobacco industries. And I see the way forward on two fronts, one for research and one for advocacy. And one is to further examine industry's discursive power, and for advocacy, increasing awareness and countering industry's tactics. So if you know of any research or advocacy funding opportunities that can possibly fund these ventures, please point me in the right direction. And with that, I'll just share the references of my PhD and this presentation as well. So thank you very much for your attention.